Hi, everybody. So, I am so excited to have my first speaker with me today with the US Canada portion of Meant to Be Well. I am here with Dr. Lori Davis, and Dr. Lori Davis is incredible. She is an amazing speaker, has an amazing platform. She is joining us from New York, United States, and she's a licensed clinical psychologist who specializes in anxiety and post traumatic stress disorder. She is a clinical instructor at Cornell Medical College, professional associate at New York Presbyterian Hospital, former assistant director at the NYU Institute for Trauma and Stress, as well as the former director of a free treatment program for individuals adversely affected by the events of September 11th. Her incredible platform is an awesome resource where she shares strategies and tips for anxiety. And Dr. Lori reminds us that you can be anxious and shine. So thank you so much for being with us today.
Valerie, I'm really excited to be here. I think it's incredible that you've all banded together to create this global mental health platform. I think it's amazing, and I'm so happy to be a part of it.
Oh, thank you so much. And I was just telling Dr. Lori, I'm glad that she's the first one of the US Canada portion because I'm a little anxious, but you know what? That's okay. We all are anxious, right? We all have some anxiety, and it's okay to still be anxious and shine. And I love that that's what you do. And you also come right out and say that you have anxiety too. Is that right?
That is correct. So my platform is You Can Be Anxious and Shine. And I start off all of my videos with, I'm Dr. Lori Davis and I have anxiety too. And it's totally true. So if you're anxious today, not to worry, I'm anxious today. So we can be anxious together. But I think that one of the goals of my platform is to let people know that you can have symptoms of anxiety or depression or really any mental health symptoms, and you can still set goals for yourself. You can set goals, you can follow through with goals, and you can learn to manage your symptoms. I don't speak a lot about a cure for anxiety. I speak a lot about learning what your triggers are, learning different strategies, and accepting the fact that you may have anxiety at some points in your life, maybe many points in your life, but that doesn't mean you can't be who you want to be. And my mantra really is, it's never too late who you might have been. So when I say you can be anxious and shine, I don't mean it in a hokey way, because sometimes people will say, well, I feel lousy. How am I supposed to be shining right now? Like I feel my heart's racing or I feel sick to my stomach. What I mean is you can manage the symptoms and you can feel lousy at times, but you can still be moving forward. And you can create a plan for yourself around anxiety and any symptoms you have. And you can still set goals each and every day of your life as long as you are approaching the anxiety. And this is the key piece about anxiety, that avoidance just feeds symptoms. And I sort of probably hit people over the head with that, not literally, that you need to approach your fears, whatever it is, whether it's public speaking, or whether it's driving or getting on a plane or going to social events. If you don't approach, you'll just feed the symptoms and they'll kind of stay put. If you approach slowly, you'll see gains over time. So small gains lead to, larger gains over time.
Absolutely. And I think it is truly about that growth mindset of leaning into the anxiety because, gosh, I know my whole life I've struggled with that as well. And it is so hard sometimes to lean into that anxiety. But baby steps. I mean, I've had to do that so much of my life of just leaning into it and just kind of letting that wave wash over me. At least that's kind of one of my coping skills for anxiety, of knowing that it'll rise, taking some deep breaths, allowing myself to take a mental back road. What are some anxiety coping strategies that you recommend for your listeners and things that you have felt like have been helpful in the past?
Absolutely. I have a host of strategies. And I want to say at the outset that one size does not fit all. You
Yes.
can read a book that says do these 5 things for anxiety, and you can come away saying none of these are working for me. And that is okay. There's nothing wrong with you. Just try different things. And so over many years, I've put together my own individualized plan, basically. So that includes box breathing, basically every night before I go to sleep. If I feel my heart's racing in bed or I can't take it down, I do box breathing, which means just breathing in for 4, holding for 4, We can do this right now.
Yeah.
Breathing out for 4 and then holding it for 4. That's one of my favorite strategies. Visualization. I can, no matter where I am, I can, except if you're driving, I can visualize a safe or a very calming place. For me, it's by a bubbling brook, and I can imagine what I see, feel, hear. And that helps to take my anxiety down. I do that maybe for a minute. I can do that in the middle of the day. I can do that while I'm going for a walk. I can do that at a social event. Just imagining a place where you feel safe. And it basically gives you and your nervous system a reset. Just visualizing a place that's not anxiety provoking. It's really so helpful. And I've been doing that for years, and I often teach patients to do visualization skills. I have a heating pad and a neck wrap that I use all the time. I actually did a video on the neck wrap. I got it on Amazon. I really got it for some sort of neck pain, just being on the computer all the time. And then I found, wow, it's making me feel really calm. And I just pop it in the microwave for a minute and a half, wrap it around my neck, breathe a little bit, and then I'm like probably 40 or 50% less anxious and just more relaxed. And a heating pad too. You can travel with it. Again, you don't want to get too hooked on these coping strategies because you don't need them to become security crutches. But if they help you with your anxiety, you're not hurting anyone and they're helping you. So I think that that's a great thing. I'm a huge proponent of massage, Valerie. Like, massage can be expensive. You can go to a nail salon for 10 minutes and you can have them rub your shoulders, because often when we get anxious, we walk around with our shoulders up to our necks. The trapezius muscles get tight. We lean in all the time. Even just being on the computer kind of tightens everything up. So massage is another way to just kind of reset and take it down. I do that religiously. Stretching every day, gentle yoga, going for walks and getting absorbed in nature, being externally focused, get out of your head and into your environment. Look at the trees, try to really get absorbed in the 5 senses. Another strategy I use all the time is talking into my phone. I turn the microphone on and I get all the thoughts out of my head and I put them on my phone and I just speak out loud and I just say everything that I'm worried about or anxious about. And again, it's taking the thoughts from here and putting them somewhere else. Some people find that journaling is a good way to do that. My point about that is you can do this into a corner. Like, people can journal for 25 minutes and then actually get activated. So anything that you do, whether it's talking into the microphone or writing, if you start to feel more activated, that's a good time to stop. You don't want to get flooded with anxiety. Aromatherapy is great. I have stress dough, which smells like a spa, which is really nice. I did a video on that. Lavender, just putting a few drops in your palms, rubbing them together, cupping them over your mouth and taking 4 deep breaths. Another quick tip is, if you're feeling really anxious and it's very thought-based, go and do something concrete. Go clean out your closet, reorganize your sneakers.
Yes.
Take the dishes out of the dishwasher, whatever it is. Do something very concrete and body focused. Or I'll do a plank for 60 seconds or maybe 10 push-ups. I'm not really that great at them, but I still do that. And finally, getting absorbed in other people's lives. With anxiety, you can get so in your own thought process that texting or even picking up the phone and reaching out to a friend or relative or a colleague and saying, how is your day going? Tell me a story about what happened to you today. And all of a sudden you find yourself into someone else's experience and existence, and it pulls you right out of your own experience. So I try to do that at least a few times per week. So those are just some, strategies that work for me, but there are endless strategies and books and videos. But keeping in mind, again, if something doesn't work for you, it doesn't mean you're not doing it right. It doesn't mean you're approaching anxiety in a wrong way.
Yes, absolutely. I think that's such a great point, because it's not a one size fits all with this. Like, some things work, some things don't. I know for me, cleaning, gosh, I have been cleaning my house for the past couple of days, Dr. Lori, so much, because it kind of gets my mind going when I start
Right.
all this stuff. And and it's easy. I think it's Dr. Ron Siegel that talks about that thinking is the human survival skill. Like, we don't have sharp claws, we don't have things that other predators may have, but it's our thoughts. But sometimes our thoughts can get us into trouble sometimes. It's like our brain's trying to serve us, but it's not necessarily real. It's not a real threat. It can be a false alarm so much of the time.
Exactly. And, I think to your point, we need it, we need some level of anxiety because
Yeah.
that is how we survive from an evolutionary perspective. We need it. It's just that when it kicks off too much and our thoughts are racing all the time and the what ifs and feeling on guard and so forth, that's when you realize, well, this feels like it's really impacting my life, the things I'm doing, the things that bring me joy. But
Yeah.
yeah, the thoughts kind of take on a life of their own, even if, as you said, maybe there's a kernel of reality in those fears, but then they blossom and they get so big, like this mushroom cloud over your head. So often it's another strategy, per your point, is challenging those thoughts. Like, I'm really afraid because I have a work event coming up. What if I mess it up? What if I sound silly? And then really looking at evidence for and against that. Like, has that really happened to me? Maybe it did happen once, but that doesn't mean it's going to happen all the time. So you never want to negate your fears and your feelings. You just want to challenge them a little bit, shake them up a little bit. And sometimes that can kind of take these really big worries and thoughts and at least bring them down a little bit so it's more manageable for you to approach that. I guess the other thing is self-compassion.
Yeah.
I know when you and I spoke several months ago, we talked about this. Many people have anxiety. In fact, across the globe now, over 300 million people suffer from an anxiety disorder. And that's what's reported. So who knows what
Yeah.
the true number really is. But having compassion, like, these are difficult times right now. And we're all really busy people and we have many responsibilities. And so we're an anxious group at this point and kind of normalizing that. Well, of course I feel worried. Of course I feel anxious. It means you care about the things, your job, the people in your life, your relationships, your job, the world, the environment. It means that you care. And so we have a lot to worry about these days. The numbers are really high. So acceptance that you have anxiety, you may have it all the time, you may have it some of the time, you may go through life transitions where it kicks up and then decreases, but providing self-compassion, not going like this to oneself. Why do you have this? You can do better. The next person is not anxious, or this person can do 10 more things than I can. What's wrong with me? All that does is feed these self-negating thoughts and also depression and frustration, which we don't need on top of anxiety.
Absolutely. Absolutely. I think that's such an important point because it is so easy to be hard on yourself. Like, just why can't I? I know for me, I've thought about that so much. Like, why do I still have anxiety over this? Why am I so worried about whatever it is? And it's kind of, I think for me, a lot of it's like that power of yet. Like, for me, I will think, well, maybe I'm just not there yet. And I'm working on it. I'm working on this. And I'm safe in the moment. And a lot of times that's what I have to say. Like, if nothing else works for me, just telling myself right now, I'm safe. That kind of
Yeah.
helps calm myself a little bit.
Yeah, sometimes it's just getting through the moment. Like, I know there are days I'm going to be really anxious, and I try to tell myself, okay, I'm going to just try to get through today. I'm going to use my strategies, try to be kind to myself, and I'll know that this day will come to an end or this event will come to an end and it will be behind me now. And so being very present focused is also really important. Not overly focused on the past, not overly focused on the near future or the far future, just kind of like what's going on right now. It's handling things in smaller pieces, right? If you look at your whole life or the whole world, or your whole career, it could be really overwhelming. I know it is for me at times.
Yeah. Like, if you think back, like 10 years from now, will this be something? 10 years from now.
Yeah.
It kind of
Yeah.
puts in perspective. Well, that's amazing advice, Dr. Lori. What else have you learned to work with, like with your own anxiety? I know you talked about some tips and strategies.
Sure.
Is there anything else in particular that you'd like to share with us about your own journey with anxiety?
Yeah, I think a couple of things. One, be kind to yourself. Two, if you really find you get to a place where, again, you're not enjoying the things that usually bring you joy, and because this question comes comes up a lot with patients or friends of friends, like, should my kid be in therapy now? Should I go to therapy now? I've certainly dealt with that in my own life and have learned, if I'm really at a stuck point, right, which often happens during transitional periods, like kids go off to school, you're starting a new job, marriage, divorce, death, just life transitions, menopause, whatever it is, your anxiety may get kicked up. And if you're really having trouble completing your sort of daily activities, taking care of your home, getting your work done, you're not sleeping well, you don't have an appetite, you don't want to see your friends, whatever it is, then I've learned that it may be time to seek out professional help. And I think there's a sort of, in our culture, you should be able to handle everything, do it yourself. Obviously, therapy is more accepted now. But I think with anxiety, it's diminishing returns after a while if you really don't seek help. And again, you could speak with a clergy person, you can get into spirituality, mindfulness, whatever it is. If you don't deal with it, though, you're going to get walloped versus, okay, I'm at a point now, it's really impacting me. So I need to pay attention to this. I can't keep pushing it away. And, friends and family will always try to say, well, what if you go for help? And like, it has to come from the person themselves. Otherwise, they're not going to own the treatment. Or spiritual, exploration, whatever it is. So I think understanding when you've reached your point of, I'm not able to be myself in the way that I want to, it's a good time kind of to reach out to help. The other thing is trusting your gut in life about what feels right. Certain situations are anxiety provoking and may leave you feeling depleted. Maybe that's not all biology. Maybe you need to pay attention to some of the people you're hanging around with or situations that trigger you. Now, I've preached no avoidance, but that doesn't mean we should continue to be in situations that may not be healthy for us. That's not necessarily engaging in avoidance. That may be healthy limit setting and setting boundaries. So I've learned to pay more attention to that along my journey. But the most piece about it is that you need to go slow, right? If you get anxiety, whether it's panic attacks or generalized anxiety or social anxiety or OCD, even trauma, like, you need to start slow and work every day at it. There's no cure for this. It's setting small goals, which again lead to a larger change over time, and trying to be patient with oneself while you're doing that. It takes time, and it's not an upward slope of recovery.
Yes.
It's like you could be doing great and then life gets in the way. Something happens, a crisis happens, or a change in life occurs, whatever it is. So the slope may look like this, and then like this, and then like this. And that's just fine. That you have to kind of go with it because life is unpredictable, which is the main thing that breeds anxiety, not knowing.
Absolutely. It is like life change is a part of life, and that can be hard sometimes, that not knowing, and
Yeah.
exercising that anxiety pathway, working with anxiety, having that self-compassion. I think those are such great points, Dr. Laurie.
And you do that a lot with, with your, your mission really to help moms. I mean, it's a totally stressful, long phase of life that could be very joyful, but extremely stressful. And you're very realistic about it. And, it always changes. And you have to learn to go with the change, even though it's very anxiety provoking and sometimes frustrating. But kind of normalizing that experience, providing strategies like you do, and starting a dialogue around it. Same thing about anxiety.
Yeah, absolutely. And I think that's it's so much of life, right? Like we always, or at least for me, I'm always trying to be perfect at everything. And it's like, that's not realistic. If you look at nature, which helps me with my anxiety, like looking out a window or going for a walk, there's so many
Yeah.
examples of that. And nature's not perfect. And so why are we putting that expectation on ourselves? Like we shouldn't be. We're beautiful, even though we're imperfect, even though we're working on our anxiety and our worry and whatever that is. And I love how I truly can visualize, Dr. Laurie, like you shining with anxiety, because I think you're a perfect example of how you come out and say, you're Dr. Laurie Davis, but you have anxiety too. Like that's just, it gives us hope. It gives me hope that it's okay. Just lean into it, embrace it. Like we all got this. I have a bracelet on right now that says, you've got this.
Oh, I think Maybe you can send me the link. Maybe I need to get one myself.
Yes.
But
Yeah.
yeah, I know we have to stop it. But we're so socialized to be goal oriented, to push forward, to be able to handle everything. And then you look to the right, you're supposed to be doing this. You look to the left, well, I must be doing this, or I didn't do this. And it's like a stress bubble all of the time. And we're just not as easy on ourselves as we can be. So I'm trying to be easier on myself. Hopefully you are too.
Yes.
You can aim for being pretty amazing, but not perfect. I know I don't always shine. I certainly know that the people who know me know that I don't always shine, but I think I've learned that that's okay too. I might shine the next day or the next week.
Absolutely.
I
And I
mean,
think
yeah.
and that's the beauty of it, right? They say, I'm not always shining, but I know that that's okay. That's okay. Like this is life and life isn't perfect. Like we have sunny days, stormy days. It's all part of life. It's beautiful.
Yes. Yes, absolutely.
Now, Dr. Lori, as we wrap up here, I would love for you to share with our audience who's listening either to this live or to this replay where they can find your incredible information. Because I just love looking at your Instagram page as well as like when you guest on podcasts. Like you just have such pearls of wisdom for us.
Thanks, Valerie. I appreciate that. So my Instagram feed is at Dr. Lori Davis, and I post reels probably 4 times per week. Anyone can reach out, send me a message on Instagram. I don't provide clinical, advice on
Mhm.
site, but say hello and introduce yourself. If I can be of help in any way, let me know. They can find me on my website, drloridavis.com. That's also linked on my Instagram feed. And, part of doing the Instagram feed is to reach out to people across the globe, which is exactly what you're doing today and tomorrow. And I really love that. And again, I'm really glad to be a part of this. And I think, one of the things that's helpful is no matter what's going on in the world, we are all humans and we all have issues and we can share information, hopefully without judgment and with compassion. And I think that's hopefully what I'm going to continue to learn today and tomorrow as I watch all of your speakers, the many, many people you've pulled together to kind of promote wellness on this really important platform. So thanks again for letting me be a part of this.
Oh, absolutely. Well, thank you, Dr. Lori. And I have here on the chat. So if people want to take a look at all of this amazing information that Dr. Lori has on her page, you can click on her Instagram link as well as her website. And I think that what I would like to ask you, Dr. Lori, as we wrap up here is maybe what can we do today? What can we do today to work on or to give ourselves some grace to know that we're human and it's okay to have anxiety or whatever it is we're working on. What can we do today about that?
Well, I would say, in terms of anxiety, there are different reasons people get anxious. And typically it's a combination of biology. That's how you're born. Like that is not
Yeah.
your fault. Just like you might have, again, you might have diabetes, you might have high blood pressure, whatever it is, like that's part of your physiology. Again, not your fault, and understanding that. And then there are life experiences starting very early when we don't even have the emotional capacity to understand what's happening to us. So we all have anxiety, and it doesn't feel good. It's never going to feel good. Nobody goes, yay, I love having anxiety. This is the greatest thing. So understand it doesn't feel good, but understand that you have choices and that we all have choices every day of our lives. So when it comes to anxiety, you have a choice to learn what you can, soak up information, read what you can, and try to do it without self-judgment. We all slip into that here and there. I do too, of course. But try to move forward with the understanding that you can create a plan for yourself and you can help your anxiety and you can manage it over time. So think about that today. You may be feeling lousy, but you might feel better in a couple of weeks with some new strategies. It happened for me. It can happen for anyone.
Mm, absolutely. Well, thank you, Dr. Lori. And
Thanks, Valerie.
absolutely. And thank you for everyone who's making comments. Gretchen, Ambreen, Chan, really appreciate it. Anyone who's listening. Gretchen, in my journey, the one thing that I have done is offered myself patience and grace every day because I am far from perfect. Absolutely. Me too. Far from perfect. And we're all in this together in love. all across the globe. And Dr. Lori, I am going to pass on the torch to the next speaker here. So again, thank you again, and stay tuned for our next speakers, Frank Sinclair and Lisa Sennett. So thanks again. Have a
Thanks,
wonderful day.
Valerie. Great to see you. Take
Thank
care.
you, you too.
Okay.
Bye.
Bye.